In one of my public lecture, I said this, that above 30, then my daughter, who was in the audience, she asked, she was 8 years old, that no, children also get stress. I read about it and found that even fetus, when they are in the womb of mother, they also get fetal stress. Best treatment is relaxation therapy and given by India to the world. Yoga, meditation. This is Shavasana. I guess everyone can read about it. And this is adopted by Western society as progressive muscular relaxation for treatment of hypertension. If you do Shavasana for half an hour in the morning, half an hour before going to bed, you won't have this problem. So behavioral therapy, changing your personality, not relying on drugs is the best way to lead a stress-free life. Thank you. Next question, please.
Yes, sir. This was absolutely an important information. I think all the students must have noted it fairly well. My next question is from Shubham Sharma. He's from MCA. Shubham, are you here?
Yes, ma'am. Good afternoon, sir. Good afternoon, ma'am.
Good afternoon.
Sir, my question is, how much exercise is recommended to help prevent heart disease and to keep the heart healthy?
Well, this question has two parts. One, how much exercise is required, which we call as cardio. That means you are already having normal body weight, you do not have much stress, then exercising which increases your heart rate by 20%. Normally heart rate is 70 to 90. So exercise which will bring 20% more, that is 110 to 120 heart rate, and maintain it for 20 to 30 minutes, at least 6 days a week. So that can be achieved by brisk walking, by treadmill, by any other forms of play, cycling. But if you have to lose weight, then you have to burn calories. Then exercise should be aerobic, and you have to do it more rigorous exercise with after doctor's permission, especially in obese people. You have to burn almost like one samosa contains 500 calories, and 7,700 calories need to be burnt for losing 1 kg weight. So you can imagine harmful effect of eating one bread pakoda or one samosa or one cheeseburger. That is 600 calories.
Should we move to next question?
Please.
Right. Thank you. I think Shubham's question is very well answered by Dr. Grover. Now we have Archie Singhania from MBA. Archie, please ask your question.
Good morning, sir. Good morning, ma'am. So my question is that what are the reasons for bad cholesterol and what measures can one take to control the same?
That's also an important question, because cholesterol, especially in India, is a problem. These are absolute values you must have seen, and always ask for not cholesterol but lipid profile, which measures all the important component except lipoprotein A, which is very expensive test. So lipid profile, at least total cholesterol in both genders should be less than 190 milligram per ml. LDL, that is low density lipoprotein, less than 70 milligram. Less than 100 is okay if you do not have any other risk factor. But if you have any of the 8 modifiable risk factors, it should be less than 70. HDL should be more than 50 milligram. This is not given in most of the reports, that it should be more than 50 in ladies and more than 40 in gentlemen. So this difference is important. This is good cholesterol, HDL. Bad cholesterol is your LDL. LDL less than 30. Important thing about triglyceride should be below 150 milligram is that sugar or refined products which we eat, processed products which we eat, carbohydrates with high glycemic index, they immediately increase blood sugar. That is converted into triglycerides. So this is an important, people have triglycerides over 400. Other factors may be normal. Different drugs are required then in triglyceride management. The commonly used drug, statin, atorvastatin, rosuvastatin, you must have seen prescriptions for. If there were no side effect, like about 2% of them have liver problem, liver dysfunction in after 1 month of dose. Otherwise, this is such a good drug that it could have been added in salt, like iodine, if this liver problem was not there. So you're lucky if you have no liver dysfunction after 1 month use of statin, then it should be taken by practically everyone above 50.
This is very informative. Can we move to next question, doctor?
Yes, please.
Yes. Next question is from Priyanka Paliwal. She's an MCA student. Priyanka, please raise your question. Priyanka?
Good afternoon, sir. Good afternoon, ma'am.
Good afternoon.
Sir, I would like to know that with the problems like high BP, how one can keep their heart healthy?
You have to control it.
Sir, this is the problem which already occurs with the age growing.
Yes, above 40, we found that 80% had high BP. This was conducted when I was young, you can see from the photo. But the World Health Organization posters says 2 very important things. There are 1.1 billion adults, that is 1 in 7, who have high raised blood pressure. And important thing is less than 20, 1 in 5. So 1 in 7 have high blood pressure in whole world, and only 20% of time they have kept it low. Simple measure is if you do cardio exercise, that is, and keep your body weight below or normal, that is body mass index. There are charts available, there are formulas available. The book will be available in your library by tomorrow, I think, which tells about body weight. And if you keep ideal body weight, you do exercise, your blood pressure can be controlled with non-pharmacological, non-drug means. One important thing I forgot to tell you about exercise is exercise leads to release of endorphins, which gives euphoric or pleasant sensation. So that is the benefit, another benefit of exercise. It reduces stress, and stress at blood vessel level cause damage and raises blood pressure.
Exactly. Very well informed, Dr. Grover. Our next question is from Ankit Verma. He is an MBA student. Ankit, please ask your question.
Thanks a lot for taking my question, ma'am. My question to Dr. Grover is, what is the difference between type A and type B diabetes, and what are their individual and collective impact on our heart?
Thank you. Diabetes is most important risk multiplier. Like if you have any other risk factor, and additionally you have type 1 or type 2. Type 1 is from birth, there is lack or deficient insulin secretion. So they have to be treated with replacement of insulin. Effect is the same. And type 2 diabetes is maturity onset diabetes, which can occur in young also. So there is an overlap. And as far as effect on cardiovascular systems are concerned, they speed up heart disease, risk multiplier. So diabetes, you have younger patients. As such, in India, age of cardiovascular disease patient is 10 years younger than developed world. Other most important and easily forgotten, that heart attack, angina, myocardial infarction can occur silently because nerves are affected. There is neuropathy. Practically every system is affected. So silent heart disease discoverable only by performing ECG. Patient having only some breathlessness on exertion, some shortness of breath. That may be the indicator that, along with obesity, that he is a diabetic. Fasting blood sugar level, even 1 milligram above 111 milligram, as no investigation is precise. So the recommendation from World Diabetic Association is measurement of HbA1c enzyme. It should be below 6.5 depending on labs. And it gives average blood sugar of previous 12 months. It can be done in non-fasting patient. So every last 3 months, so 12 weeks, blood sugar. So repeated, if it is more than say 7 or 7.2, then it should be repeated every 3 years. It affects kidney and causes protein loss, leading to kidney disease, which can be progressive. You are seeing two of our ministers, central ministers, who died because of diabetes in association with heart disease, and they required kidney transplant and life was curtailed. So risk multipliable, it choices you can make to lower risk for heart attack and stroke or other risk factors should be decreased. Diabetes should be diagnosed, it should be treated appropriately and followed up.
That's great. I think type A and type B must be pretty clear by now to all these students and how to take precautions also. My Next question is from Kirat Deep Singh. He is an MBA student. Kirat, are you here?
Yes, ma'am. Yes.
Please ask your question.
Yes. My question is that what are the signs of heart blockage and what could be done as first aid in case of emergency?
Okay. The answer will be little lengthy, so I'll start from the most severest form of
Sure.
heart disease. Well, today we are talking about coronary artery diseases, but coronary heart disease isn't the only one. This was slogan of World Health Day 2011. But coming back to coronary artery disease, it can be silent, as I told you, in diabetes. It can have chest discomfort, chest pain, breathlessness on exertion, that's angina. It can have heart attack of two types. One is not associated with arrhythmia, which gives you time, prolonged chest pain. You need to take to the patient to the hospital. We'll come back to that. But most serious form, as much as 25% of heart attacks in US, the most developed country, or almost most developed country, but at least most accurate data, do not survive because death occurs within an hour. That is the definition of sudden cardiac death. That means of all the sudden cardiac death, 75% patients survive. They are called survivor of sudden cardiac death. So much so that we visited Disneyland in 2012. In the park, there was like call emergency number, which is universal number in US. Emergency defibrillator was there, that you open it, put the pedals on chest, it will read ECG and give appropriate shock. So that is the significance of most severe type of cardiac arrest. Actually, since it is occurring in community where doctors are not available, especially in India or most of the countries except the most developed ones. There has to be more sessions like this. That is, I call as partnership of health and education institutes. So much so that in Nepal, they have made a center like AIMS, but they have called it not BP Koirala Institute of Health Sciences, not medical sciences, because stress should be on prevention and treatment at the level of community. Most of our training, right from the days of Lennox, who invented stethoscope, to present time when we have such seminars, have focused on training in more glamorous form of treatment rather than the basic prevention. So coming back to silent coronary artery disease, we have to take risk factor surveillance, that means community level and control. So involvement of primary health workers or multiple health workers or school teachers. Angina, if it is present when you have chest pain, drugs and aspirin. Aspirin is wonder drug. most of the people can tolerate it well. If you have heart attack before and patient is conscious, dissolve a tablet of aspirin in a glass of water and give it to him. There are 40% chances that his blood clot will get dissolved. Such a wonderful drug. If patient is unconscious, there's a collapse. In India, importance is of CPR, that is cardiopulmonary resuscitation. It used to be ABC, that is airway, breathing, and compression of, that is compression of chest. Now the recommendation is, if there is a sudden collapse outside the hospital, you start compression. After 15 rapid compressions, first make the patient lie on hard floor, maybe ground. Then compression. Then see that chin is pointed towards sky and mouth is kept open so that mouth breathing can occur. Mouth to mouth respiration may be needed. By the time ambulance should arrive, and you should be able to take the patient in cardiac ambulance to the hospital. In hospital, patient will be evaluated, ECG, echo, treadmill test as per need will be done. There is pharmacological treadmill also when patient need not exercise because of leg problems. Issue is we don't have resources, we don't have monetary resources, but that's not exactly true if education is given. If knowledge is, and even at World Health level, there are efforts being made to have affordable medications and affordable instrumentation like stents. You see a plaque, you insert a balloon covered with SEM, inflate the balloon, withdraw the balloon, and you have open artery. So this is mechanically very simple but expensive. But if you take all preventive steps, perhaps you may not need it before you are 80. Well, with this, I conclude. If we do not pursue achievable goals, the race can never be won. Mount Everest, cloud shall clear. Thank you for your patience.
Thank you, Dr. Grover. This was absolutely informative. The last heart blockage was so close to my heart, and actually I found it so informative. We really do not know so many things about how to manage our heart. In fact, this was so insightful and informative session. I believe many millennials who are sitting over here must be more clear and confident about various heart-related questions, issues which arise in mind, and they must be now knowing how to take care of their heart and that of their loved ones too. Student, you should understand one thing, that liquor, tobacco, alcohol, lack of sleep, lack of exercises, all these are reasons of hypertension and anxiety. And if we actually look into the root cause among the heart patients, especially among the youngsters or community, we'll find that these are one of the major reasons, as Dr. Grover also highlighted in between during his presentation. So let us come together and pledge against heart failures. Pandemic or no pandemic, heart failure is growing as a disease. And so certainly I think so that it requires much of attention. Dr. Grover, thank you so much.
Thank you.
Before ending, we would like to share a memento with you as a gratitude and thanks for giving your valuable time and contribution here today.
You're most welcome. Thank you. Yeah, I love that. The books the parcel is on the way.
Yes, Dr. Grover.
And if you need more or if you need Hindi version, I'll be able to send.
No, let them come. We'll keep it in library for the students also to go in the library, pick up and read and gain as much as possible from you. And in case any student really want to come up with any of the particular queries, we will we'll come back again to you with some questions in future. And I think the time is running short because of the another next 40-minute session. And before we end, I think you will also give the same advice and we will also give the same advice to everybody that eat healthy diet, live healthy heart, and use heart to stay active. Thank you all and have a wonderful day. Thank you, Dr. Grover, once again. Thank you so much.